out of 4 people will develop pelvic floor problems at some point in their life. Ignoring it can lead to many issues such as low back pain, organ-related issues, as well as a whole host of other pelvic health problems. Your pelvic floor is the key to a healthy body and a strong core. And one of the most common issues that both men and women suffer from is a weak pelvic floor. Not fixing your pelvic floor can lead to things like incontinence, where you have difficulty controlling your pee. Low back pain, as your pelvic floor plays an important role for the strength of your spine and your pelvis. Core weakness. Your pelvic floor is an important stabilizer along with the abdominals and the low back to support your entire core. Pelvic organ prolapse in women. This is essentially where the pelvic organs can start to drop. This can include the bladder, the rectum, the uterus, and the vagina. If you're having pelvic floor weakness, here's what not to do. High impact activities that involve things like running, or jumping. This can place excessive strain on your pelvic floor due to increased pressure inside your abdomen. Abdominal exercises, such as hanging leg raises, planks, and crunches with fixated legs. It's almost inevitable that you will develop compensatory strategies if you have a weak pelvic floor. Straining while having a bowel movement. Straining can place excess pressure on the pelvic floor, leading to further weakness. Breath holding. Holding your breath can also place excessive strain on your pelvic floor, leading to weakening and incoordination. Heavy weightlifting. As I mentioned before, your pelvic floor is essential to having a nice, strong core. And if you don't have a nice pelvic floor contraction, then this can lead to compensatory strategies when you lift, leading to strain and low back pain. Now let's talk about what you should be doing. Transverse abdominal exercise. Lay on your back with your legs straight. Take a breath in, and as you exhale slowly, and the key here is slowly, make an S sound. As you make that S sound, you should feel that you're feeling a deep, slow tensioning of the deeper abdominal muscles. Hold that contraction for 5 seconds and do 10 repetitions. Kegel elevators. Lie on your back with your knees bent. Take a breath in, and as you slowly take a breath out, I want you to create a graduated pelvic floor contractions, essentially like you're holding back your pee over 5 seconds, going from 1 to 5, almost like an elevator lifting from the first floor to the 5th floor, with the 5th floor being your maximal contraction. Once you get to the top, you're gonna hold it for a couple of seconds, and then you're gonna gradually release it back from 5, 4, 3, 2, 1. Try not to compensate with your inner thighs, your gluteal muscles, or excessively with your abdominal muscles. And you're gonna perform a total of 10 repetitions. Quick Kegels. Lie on your back with your knees bent. Take a breath in, and as you take a breath out, start creating a contraction up to 80% as if you're holding back your pee. Hold it for 2 seconds and then let go. Perform 10 repetitions. The clamshell. Lie on your side with your knees bent, keeping your feet in line with your back. Take a breath in, and as you take a breath out, connect to that transverse abdominal as well as that Kegel contraction to about 30%. Keeping that connection, lift your top knee up towards the ceiling, keeping your feet together. Hold at the top for 3 seconds and slowly lower. You're gonna do about 10 of these repetitions. The side leg raise. Lie on your side with the bottom knee bent and the top knee straight. Take a breath in, and as you take a breath out, connect with that transverse abdominal as well as that Kegel to about 30%. Lift the top leg up towards the ceiling, hold at the top for 3 seconds and slowly lower. Perform 10 repetitions. The bridge. Lie on your back with your knees bent. Take a breath in. As you take a breath out, connect to that transverse abdominal as well as that Kegel pelvic floor connection to about 30%. While holding that connection, go ahead and lift your buttocks up towards the ceiling. Hold for 3 seconds and slowly lower. Perform 10 repetitions. When done correctly, these exercises can have a drastic and profound improvement in your pelvic floor strength. However, many have issues that go beyond just pelvic floor weakness. And we have courses designed for both men and women to treat things like pelvic floor pain, as well as other pelvic health related issues. So if you're ready to get your pelvic floor fixed once and for all, then check out our courses where I have been helping people for over 24 years overcome their pelvic floor problems.